Hello and welcome to all of our Gold participants from around the world. Welcome to the Gold OB-GYN Online Conference 2019. I'm Fiona Lang Sharp, IBCLC Director of Communications and MC here at Gold Learning. Well, I'm very excited today to be sitting down with Dr. Anita Nelson, who's here with us at our Gold OB-GYN conference, and she's going to be talking about, as you can see on your screen, an update on postpartum contraception, how evidence informs practice. Well, welcome to you, Anita. It's great to have you here with us today.
Thank you, Fiona. It's great to be here. Thank you.
Well, I'm very excited because this is something that I actually hear quite a bit from my clients. And I know obviously this is a topic that you've worked on before and excited about, but there's actually a lot. I was reading your bio today, Anita, and there's actually quite a bit that you work on in your field, all sorts of things that I was like, I'm gonna have to pick her brain. Would that be rude if I picked your brain, Anita? And I was just like, can you tell me about this? Can you tell me about that? But
Be delightful. And certainly, as a lactational consultant yourself, you have a lot of experience in this area, don't you?
yes, it's a big topic, and so I think there's a lot of misinformation out there. So I was excited because I get to, of course, sit down and listen ahead of time. So for those delegates who are listening in, Anita's going to be doing a recording for us at our OB-GYN conference, and it will be available, at the very beginning of the conference. So that's pretty exciting. All right, so let's dive into some of the things that you do. And why don't you tell me, maybe just start off at the beginning, Anita, how and when did you decide that you wanted to work in this field? How did it all come about for you?
Oh my gosh. No, seriously, my career has been one of Brownian motion. I started off going into law school and then wound up in economics and then went into medicine. And I knew the only thing I didn't want to do was go into OBGYN. And I
Oh,
wound up in OBGYN specializing in contraception. So if you can find a pathway there,
wow.
but in each place it was following a passion. And I think that's when we can be the most fun, right? Have the most fun is when we find a theme that we think is important and we're allowed to play in teaching and in research and writing and all of those wonderful things, getting to work with young people, just exploring their interests in medicine, in women's care, and to see over time how people have come full cycle from just discovering about reproductive health and women's rights to a time when it became more like a business to now there's a passion back around the whole issue of women's rights,
Mm,
and to see how this recrudescence, this real return to beyond just providing services, but having advocacy, and issues as important as a woman's already just had a baby. Is she going to be able to control her fertility as she's trying to give attention in time to that baby and to her family? So this all fits together so beautifully. And to see so many people as our audience today interested in these topics, and be taking them home and applying them in their own practices, that's the joy of doing this sort of activity, isn't it really?
oh, absolutely. And boy, was I ever getting absorbed into your words there, just thinking about my lifespan and how contraception has impacted myself as a woman, how it impacted my mother, because it really impacted our family. There were two babies that were born out of wedlock, and those babies were adopted, Anita. And because, contraception either wasn't discussed in their family and or wasn't used, or it was that time and that era where women didn't have access like we do today. What a privilege and honor that is. So, this is something that really goes a long way into our families. I'm sure there's many stories like mine, and I'm sure you've heard them before too, perhaps, in with clients or your family as well, that you can relate to those stories, Anita.
Well, you know what's really interesting, Fiona, is that from those passions, what your mother experienced when, or as a first generation contraceptor yourself, you felt that freedom and that ability to explore your own possibilities. You may have
Hmm.
decided to stay at home and be the mom you wanted to be, but you could do something else. And I think it's that
Hmm.
ability to decide for yourself rather than marriage or relationships meant you had a certain pathway in life. but to see how complacent people had been and how they take for granted that they can control their fertility and not recognizing how very fragile that right is and how we have to really defend it. To be watchful for people nibbling away at the edges of it and trying to take away birth control pills or
Hmm.
sending out misinformation about IUDs or implants, trying to sway people's beliefs or take their value system and say that contraception is in conflict with that when it can be perfectly consonant, right? People can, once they understand how their bodies work, can see how contraception might fit into their lives and to enable them to achieve the goals in life that they're seeking. So it's we've kind of gone through this boom and bust, and I'm just got my fingers and toes crossed that as we're coming to this new age where we're recognizing how important it is to provide women the tools such as contraception at the time that they have their babies, that this doesn't get lost again or minimized because it is so important to the quality of the health of the mom and the baby. Um, to give her and the family unit a chance to achieve the maximal health. It's all part and parcel.
Oh,
So
yeah.
looking at contraception as a tool toward health is important.
Absolutely. And of course this is something that I'm really interested in, but I'm thinking about where we are right now with contraception in the news. So there's still a lot of articles in the news, women still, looking for the right to choose. Um, so yeah, you saying, just talking about misinformation that's out there, it can be confusing, I think, for people to know what to do and the right thing to do, but it seems like, I mean, it's not going away, and I mean, obviously, but as a woman I really appreciate that, and get to see things grow. Are there still areas that you know of, or you talk to people where contraception is still viewed perhaps as a disruptor in a society, Anita? Is that something that you've learned about over the years?
Well, without getting into politics, and we don't want to, but
Right.
just getting back for our learners here today, that they spend so much time dealing with women and helping them educate themselves about their health and all the aspects of their health. And I'll tell you, you probably read about it in the history books, but there was a best-selling book that came out in the 60s called Our Bodies, Ourselves. And women got
Yes.
introduced to their reproductive organs and they learned what a uterus was and what an ovary was.
That's
And I've
right.
got to tell you, I never in my life imagined that in this year, 2019, that women still wouldn't have that basic information and that
Right.
they don't have, the understanding of how their bodies work so that they can make the choices for
Mm,
themselves, right? And as we're
yes.
moving into this new time when doctors and nurse practitioners and nurse midwives are going to have less and less time and fewer visits, so
Mm,
much more of the decision making and the prompting or entering into the medical system is going to be triggered by the woman herself. And does she have the tools today to know whether that vaginal discharge is a problem or those cramps are an issue, or should she accept that bleeding, or is it really a sign that she has something wrong with her and she needs to
mhm.
seek help? And I think that from now until the time that some of those new changes come down the line, we all have to dedicate ourselves to helping women learn about their bodies and their own health so that they can be advocates. So I invite all of your learners,
Oh,
not
wow.
just specifically on this one topic, but look
Sure.
back and say, what does she need to know so she can make these choices herself?
Yeah, absolutely. And I mean, I also have seen such a positive change too. Let's face it, we've got to talk about the things that have changed. Even in the last 10 years, for better or for worse,
Hmm.
our platforms, our Googles and our search bars that,
Hmm.
have provided more information and perhaps more conversation, so that we can continue to grow and learn. And those books that we had in our foundational libraries have turned into multiple other great books as well. I mean, there's
True.
good things out there now, and And I was like one of those women. I really did have to do a lot of reading, but I am grateful to the mother that I had who did, didn't have access to everything, Anita. She was able to sort of really, tell me a lot about it because, she went before me. And so she laid that foundation, and that was awesome as well. I
And you're
wanted to
standing on her shoulders,
Yeah,
aren't you?
exactly. I wanted to jump into a couple of other things that I was reading that really struck me, the consistency that I'm seeing, and I loved reading this. This was in your abstract, Anita, and you talk about the postpartum period has now been recognized as the fourth stage of labor. And this is something that we're seeing throughout the field of, perinatal medicine. So, when did this language start to come to fruition with you, and how does this sort of relay and thread through your presentation with us?
Well, clearly, we've always known that after the placenta's out, the woman doesn't bounce back immediately, that there is that recovery period. We know
Right.
that after she delivers, she's at the very highest risk in her whole life for forming blood clots.
Hmm.
We know that she's susceptible to mood swings, that her whole life, as she's known it, has been turned upside down, and she's trying to take care of this little baby and sleep deprivation, all of those types of things um, that occur to her as her body does normalize to its new normal. That whole transition period is very important, and we ought to be spending a lot of time during the prenatal care helping women learn about those changes and what to expect. We're seeing in the literature a lot of complaints that women hit this. Of course, oftentimes they swallow it, right, and they just put
Hmm.
up with it. But
Sure.
so very little preparation goes into the moments after the delivery. And I understand that the health risks that occurred during pregnancy are often minimized
Mm.
because women are so focused on that delivery itself. But we
Yes.
really do need to have women understand what's happening to their bodies, what the health risks they face, gestational diabetes, preeclampsia, so they
Hmm.
can be part of the team looking for those changes. And of course, we want to make the natural process of labor and having the baby wonderful, but have her understand that there is sort of the other half of the equation as she develops her new normal and all the needs that she's going to have and what she can do to prepare and herself and her whole little family around her so that as a unit they can work into their new family position. But the changes that she's going to have there, help her understand them and be a part of the team looking for any changes that might not be normal and she might need help with.
Yeah, absolutely. And for me, it's a little bit of a hill to die on. If I could just protect those women post birth, we've been talking at our perinatal conference, Anita, which I'm sure you can relate to and understand about the perinatal mood and anxiety disorders that happen in that time, and how women are shocked to, find out what's happening, and it's not what they thought. It doesn't meet their expectations in that immediate postpartum.
Hmm.
And so there's so many things that they have to deal with and expect that bounce back to happen within, a couple of weeks. And it's just not realistic for the body. It needs time to heal and adjust, just like it did to grow the baby. So this is really important work.
Well, I like your analogy. That's a great one. It took us a while to get here, right? It's like when you want to go in and lose those 30 pounds that you put on, it took you a while to get them on. It may take a while to
It
lose
may
them.
take a while.
And
It may take a while. Yes.
absolutely. And that's true with the pounds that we put on with pregnancy too. So
Yes.
there
Yes.
are so many themes.
Yeah.
And we have this new little critter that
Oh,
we want to take the very best care of as we're
Bubba.
taking care of our own medical needs.
That's right. That's right. Well, this is going to be really great. Thank you so much, Anita. I would be amiss if I didn't mention because, again, in your bio, I just have to say it out loud, authored over 200 articles for professional journals and over 70 chapters in books. And so, well done, Anita. Thank you. Keep doing what you're doing. It's amazing, and we'll be keeping up to date with you. Coming to be part of our Gold Conference here, you sort of become one of the family, and we'll be looking for some more of your articles and chapters and books online as time goes on. So thank you once again.
Thank you, Fiona, and thank you all for doing what you're doing, bringing the latest information to people who really want to learn so they can bring better care to patients.
Well, thank you. And thank you to all of our listening audience. Once again, this was Dr. Anita Nelson. She's going to be part of our Gold OB-GYN conference, and that's going to be coming up really soon here. I'll just tell you quickly, it's so easy to find online, and we actually have a couple of open access and free presentations you can come and be a part of as well, starting off with Dr. Neil Shaw on November 4th. Excited to have him. And then, of course, Dr. Wendy Jones. She's going to be with us on November 18th. You can find everything online at our Gold website at goldobgyn.com. And we'll look forward to having you all there. Well, thank you again to Dr. Anita Nelson, and we'll talk to you all again soon. Bye bye for now.